Dr. Muhammad Elamin. Dr. Abdullah, please. Can you read for us?
Yes,
Can you
yes,
read for us? Just headline.
yes. Good evening, everybody.
Good evening.
Hopefully this course, everybody will get benefit. And we want to thank Dr. Osman for his hard working and his efforts
Thank you,
to
Doctor.
support
Thank you.
us.
Thank you, Doctor. Please go through this. Please.
So first we have the cardiovascular. We have risk factors assessment for cardiovascular disease.
Right.
And we have hypertension, primary, secondary, and hypertensive crisis.
Yeah.
We have ischemic heart disease. We have cardiac failure. We have arrhythmias, valvular heart diseases, peripheral vascular disease, common pericardial disorders, and lipid disorders.
Thank you, Doctor. Thank you. So this is just an initial impression for all of you. And we will try to discuss today with this limited time, though, one by one. So I'm just heading towards this. We'll be discussing now the risk factors for the cardiovascular disease. I believe most of you have seen it. Dr. Abdullah, please, can you start the discussion and interaction with me? Dr. Abdullah.
Yes.
So this is, you see the picture showing, just to know, this cardiovascular risk assessment chart. And if you find that this is discussed under the headline of the non-diabetic men. Okay, there are some other examples also. The for the men, for the women, smoker, non-smoker, diabetic, non-diabetic. I'm just showing you one example of non-diabetic men. Actually, diabetic man was before, many years before. Nowadays, when a patient have the diabetes, it is said that the patient is equivalent of having future cardiovascular disease. For that, diabetic patient actually does not need further stratification for the cardiovascular risk. That means patient is already in the risk. Considering already in the risk, that means, suppose if you see in the right side, when I'm moving the cursor, please follow. Patient with diabetes mellitus should be assumed to have a 10-year cardiovascular risk is more than 20% already. So why should we go for this systolic blood pressure, then the total cholesterol, ages, male, female, and other, whatever you say. This is the man, there be another female also there, another chart. So no need. Whatever diabetes, it means already patient have the risk of cardiovascular disease in the coming 10 years is more than 20%. And whenever cardiovascular disease is more than 20%, it will be regarded as coronary artery disease risk is more than 15%. Remember, doctor. So the cardiovascular disease is not equivalent with the coronary artery disease. So cardiovascular risk means the vessel throughout the body. Suppose ischemic brain disease, peripheral vascular disease, all together is the cardiovascular risk. So I think all of you understood how to put this. Can anyone actually want to ask me that you don't understand the chart? Please, anyone, raise your hand, please. I think all of you know. Dr. Abdullah, you know it? Dr. Neda,
Yes.
Dr. Neda is here, please. Please open your mic, Dr. Neda.
Hello, sir.
Yeah, welcome, Dr.
Yeah, I just joined, so maybe that's the reason I'm not getting the chart. I'm not understanding this.
Okay, okay. No problem. It's very easy to calculate the risk. We have to check some clinical data, smoker, non-smoker, and the gender, men and women. Okay. And I will show you maybe a few more, or the big chart. I just have taken a little part of the chart. You see, the men and women. Yeah. That means we have to consider the gender and the age. You see, age under 50, age 50 to 59, that means around 60 and more than 60, like that. There are three boxes. This is the smoker and non-smoker. So the clinical data, age, gender, and the status of the smoking. Now, we are checking the blood pressure. It is also clinical data, and we consider the systolic blood pressure, not the diastolic. And we have to do
Okay.
one blood test. What is blood test? Cholesterol,
HDL.
total cholesterol and HDL make a ratio. So if we make a plot and suppose considering the systolic blood pressure, this ratio, if you put the point here, understand? It is a non-smoker line. We are considering all the boxes for the men, non-smoker line, systolic blood pressure and the ratio. You put in the yellow area, so patient is in the yellow
Moderate.
risk. So yellow risk
Okay.
means CVD 10
Patient will
to
have.
Between
10
10
to
and
20%.
20.
10 to 20%. It may be a question in your MRCGP exam also. 10 to 20%. Cardiovascular risk, doctor. Don't be confused with the coronary artery risk. Okay. So red means red signal. Just to follow the traffic signal, I think you know, Dr. Neda.
Okay.
The green signal, yellow signal, and
Right.
red signal.
Okay,
Okay.
doctor.
I like to repeat. The patient is diabetic means patient already in the which signal? Please be connected.
At yellow. At yellow.
No, already in the
No,
red.
red.
Doctor.
Red,
Red.
Red. Usually to consider the statin therapy, lipid lowering therapy, or even sometimes to start the antihypertensive drug, we need to consider this thing. Many where you will find this, that 10-year cardiovascular risk, 20%, 30%, 25%, 10%. I hope that it will be easier for you now. Dr. Nida, clear to you?
Yeah, it's clear.
Thank you very much. So this is the
Thank you.
overall picture. I think no need to discuss more, just to show you the overall picture like that. So doctor should carry this chart, I think, right? What do you think? You should have the picture with you in your doctor's bag so that you can calculate. Anyway, there are some other ways also. Some the mobile phone applicator also there, calculators. So these are the detailed description. I think you will read by yourself. It is called cardiovascular risk prediction chart. Okay. So keeping this mind, now the question. May I request Dr. Abdullah, please? Sorry, Dr. Abdullah Al-Rashid also there. So Dr. Abdullah means actually I know Muhammad Al-Amin here. He's Dr. Abdullah and you will be Dr. Rashid. Dr. Abdullah Al-Rashid. Can you hear me?
Yes, sir. Assalamualaikum, sir.
Sir, thank you. So you will be regarded as Dr. Rashid. Okay.
Yes, sir. Yes, sir.
Because we have another Dr. Abdullah, though he didn't write Abdullah here. So Dr. Rashid, can you start it? Just to read it.
Okay, sir.
Please.
According to NICE guidelines, if a patient with diabetes has a 10-year coronary event risk of more than 15%, but no microalbuminuria, at what the threshold level of BP should treatment commence?
I think you understand the meaning of what is the message of the question.
Yes, sir.
And you understood the 10-year coronary artery disease risk also in the meantime. Okay, so it is in the red area or yellow area?
So red area.
Red area, right? Coronary artery disease, 15% is the 20% equivalent of the cardiovascular disease risk. So it's the red area around. So it is a red area now, but patient does not have nephropathy. Microalbuminuria is not there. That means organ damage is not there. Only the risk is high by calculation. Now, what will be the target blood pressure and above which level we must give the treatment? So guideline to guideline, it varies in the world. You know that there are some American guidelines. We are following the British guideline, and most popular for us and relevant for the exam is the NICE guideline. So according to the NICE guideline, what will be the target blood pressure that above which I have to start the medicine? Dr. Rashid.
B.
B means?
B. 140 by 80.
140 over 80.
140 over 8.
Fantastic. So first question, you become successful. Thanking you very much. Going to the next discussion. NICE guideline threshold of these, but 130/80 millimeter if the patient had microalbuminuria. Remember this value also. That means renal impairment is there. Our target will be the lower than the usual. Okay, lower than usual. Okay. And now, what is the target organ damage? Well, I told you one, the kidney, another, the list is there. Heart, brain, kidney, vessel, and the eyes. These are the target organ damage. When we consider to start the medicine, we need to consider, is there any target organ damage or not? So we will actually not we will actually we provided to you the learning material. You will find there the PDF. Many slides are there related with the hypertension. You will find there is some compelling indication of antihypertensive that I need to start the such and such medicine, not any one. Though uncomplicated antihypertensive will be according to the NICE guideline. So let us go there. Now come to the risk factors, and you know it, the lifestyle and other, all the pictures are there. These are non-modifiable risk factors. Suppose age is not modifiable. The obesity is modifiable, smoking is modifiable, but age, gender, these are not modifiable. Genetic predisposition is not modifiable. So very unfortunately, if patient have the background of genetic status, he will have hypertension and the cardiovascular risk. Now this is the guideline. Okay, you see the age less than 55 year, more than 55 year. So by the age, we are selecting the drug. But remember, when we follow the guideline, we assume that patient does not have comorbidities, related comorbidities, and patient does not have any other, the ethnicity. That means ethnicity means, suppose this one also, black person is special, the ethnic or racial issues, age more than 55, or the black person of any age. Remember it. Follow my cursor. Black person of African or Caribbean family, origin of any age. Suppose here less than 55, we will start A, mean ACE inhibitor, suppose 35 years. But if the patient of 35 years of this black, African and Caribbean origin, we need to start calcium channel blocker. I hope this is clear to you. Somebody is to be connected with me during my discussion, Dr. Rashid, please, as you started the question, be connected with me. Dr. Rashid.
Yes, sir.
Please be connected until I finish this topic. Be connected.
Okay, sir. Okay, sir.
It will be easier for me also to be interactive. And always try to control your noise surrounding. So you see the step 1. If you go to step 2, you know that the next time, if you need to combine the drug A plus C, then A, C, D, all of you understand D means diuretics, usually the thiazide diuretics, and your combination. When you come to the stage 4, it will be the resistant hypertension. So usually resistant hypertension better to be dealt by a specialist. So it is your responsibility now, send the patient to a specialist. So this is a very simple guideline approach. Remember, the age cutoff value is the 55 years. That, I'm sorry, it is a very big, the big slide, and may not be easy for you to read, but to highlight you that you see the drug of choice. We said that ACE inhibitor in the less than 55, ACE inhibitor, but compelling indication, according to the age less than 55, we will do. But if a patient have heart failure, whatever the age, I need to start with ACE inhibitor. If patient have chronic renal disease, type 2 diabetic, nephropathy, we need to use ACE inhibitor, but cautiously. Diabetes is very common comorbidity for a hypertensive patient. So whatever the age, it is 55, 60 or 45, it is not a matter. If patient have diabetes and hypertension, our first drug of choice will be ACE inhibitor. Dr. Rashid, clear?
Yes, sir.
Dr. Rashid, are you busy somehow? You being disconnected?
No, sir.
Be connected, doctor, because I need to interact with you like this. Be connected. So please, you need to go through this, and you need to go through, I don't like to say that you need to memorize each and every word here. By facing the clinical questions, you will learn. This is the technique of learning, not to memorize all of the thing. You just have a look only, have an idea, then go through many questions. It will be easier. Dr. Neda, please.
Doctor, I want to ask, we will get this charts and everything in the PDF, so we can review.
I think so. But all the things are collected from our common books. Even then, if you incidentally, if you don't get any slide, you just send me the message. I will actually give in the group also. Eh? I hope that I will make a group also in the WhatsApp with all of you. So some relevant
Okay.
materials in additional material I will post there. Be connected with the group. I hope within tonight I will do it.
Okay.